Hey, it's Dr. Hawkins here. I just finished an OB clinic day and I got a couple of repeat questions about the same topic, and that was, what is my actual due date? This is a great question, and it seems to be something that comes up very often because it can be quite confusing. So the way that we most accurately determine a due date is that we use the ultrasound that was done the earliest time when the baby measured at least 7 weeks and 0 days gestation by the crown rump length, which is one of the measurements that we do in early first trimester pregnancy to measure how large the pregnancy is. So if you've had an early ultrasound that's 7 weeks and 0 days by size or greater, that should be the ultrasound that is used to determine the due date. The only exception to this is a pregnancy that has been conceived with fertility treatment like IVF, where the actual fertilization date is known. In that case, then the fertilization date should be used to determine the due date of the pregnancy. What I see happening very often is that a patient will go for a second or a third ultrasound in their pregnancy, and they'll come back to me and say, oh, they told me my due date is different. But in fact, we should always be referring back to that initial ultrasound that was done when the pregnancy was 7 weeks and 0 days or greater. After the pregnancy due date has been determined by that ultrasound, it should never change again. Hope that helps.